said with the caskets, that these are real people. This isn't about politics, and we're so non-political. These are real people that are dying. They're young people. They're people that are just like you and me, that we've been fortunate we may have health insurance. And one thing Teresa and I have always found is you don't need health insurance when you have it. It's when you lose it that everything starts falling apart. This is our new clinic in Wise. Through a private donation, we were able to actually finally move off of Sister Bernie's porch into a clinic that's actually our own. We have telemedicine here, and as I said, the county donated this land, and we had a donor come through, and with the help of also the Catholic Diocese and an endowment, we were able to build our clinic where patients can come. As I said, I feel like we're very innovative. This is our service area. We're in extreme Southwest Virginia. As I said, we maybe should have just advocated and went with West Virginia because we feel very isolated from the rest of Virginia. Now I'm going to turn this over to Dr. Teresa Gardner, because in addition to what we do 365 days a year, we also organize the largest healthcare outreach in the whole United States. The numbers that I went over on the patients do not include the numbers that we see in these 3 days. And this is just incredible. It's an awesome event if you all get to come down and see it. And Teresa helped spearhead it, so I'm going to let her tell you.
So our remote area medical, there's probably people that have been here that have helped us with this great event. I mean, this is a wonderful, just wonderful event. We do it 1 day a year at the Wise County Fairgrounds. We clean out the chicken coops and everything like that, sterilize everything really good. But we hold it there at the fairgrounds. We hold it there at the fairgrounds. So because we've got access to transportation there. We've got lots of parking and things like that. It's the only place that we can really hold it because of the massive amount of people that come out to this wonderful event. 3-day event in the summer. We hold it the 3rd week in July every year. We do volunteer physicians, nurse practitioners, dentists, nurses, opticians, ophthalmologists come out and help us. A lot of lay support with this. Our primary focus is eye, dental, and medical care. The 2 big things that a lot of people, that they can't get with us, they can get, we can do the medical care in large part, but they can't get the eye and the dental clinic needs that they have. So we've been doing this for 15 years now in Wise County, and it was the largest event that remote area medical had ever done in the United States. The first year that we did it, and every year it continued to just surpass numbers. If I could kind of paint a picture, it's like what you would see in a third world country. I mean, people literally, they come and they line up days in advance for this event. They sleep out by their cars, they sleep in the back of trucks, they bring tents. It is just, you would not think that this would be happening in the United States, but it is. And like I said, it's a 3-day event. We have it on a Friday, Saturday, and Sunday. On the Thursday night of the event, Paula and I, we are literally drove to tears. I mean, you look out and you see a sea of cars. You're at a fairground, there's not a parking spot left. I mean, people are parked in adjacent fields and up and down the roads, and I mean, it's just people trying to get in there. The clinic will open at 6 a.m. on Friday morning, but people have already, like I said, they've started days in advance trying to get in for this desperate. They're desperate for medical care in this country. The things that we do, we make eyeglasses on the spot. We give complete prescription glasses, comprehensive eye exams. With the dental, we do cleanings, fillings, extractions. We even do dentures. The medical has just really grown. This is a wonderful, wonderful event for the medical. We have all kinds of specialist exams. We'll have 4 endocrinologists. We don't have an endocrinologist, in Wise County. We have, cardiologists. You just name it. We keep our patients on a list all year round to get into this clinic. And here's some of the things that we offer, like labs and mammography, pap smears, and we've got like a women's health clinic where we're doing leaks and colposcopies. Those ones that we've already identified needing, more advanced testing, sigmoidoscopies. ultrasounds here. We even make hearing aids during this event. We have a hearing aid team that comes down from UVA, and with the help of the Lions Club, they determine these patients need hearing aids, and they come back and they fit them for the hearing aids. And that is, we're actually getting ready to do that clinic from the follow-up of the reg event we had in July, where they come back and they actually put the hearing aids on these patients. And some of these patients have not heard 15 or 20 years. It's just, it's overwhelming to see these people, you know, they're just so excited to get their hearing aids and to hear, you know, a child's voice or something like that. It's very moving. We do, you know, other things with like echocardiograms and EKGs, and we even have skin biopsies, on-site pharmacy. This thing is just really exploded with the medical care that we're able to offer. But unfortunately, for some of these people, this is the only time of year that these patients get access to medical care, which is what's so sad. And when we do the follow-up after this, there's really nobody to do the follow-up except the health wagon. So about a third of these patients will need some pretty intense follow-up because we find them very sick. And so we follow up on these patients as well. But God is just really, truly blessed with this event that we have. Here is our RAM statistics for 2013. They're pretty similar for 2014. I've not updated this slide. But overall, we've been doing this for 15 years. We've provided, we've had over 55,000 patient encounters and given over $33 million worth of free care. And those are very conservative numbers for this event. At any one time, we'll have probably about 1,400 volunteers helping us at this event. It's actually so popular, we have to turn volunteers away. We're just kind of out of space there at the fairgrounds. We do what we physically do, you know, in the building structures that we have. Here's some of the pictures where they line up, like I'm saying. This is something you would, it's shocking. You would think this is in a third world country or something. It's just really, it really bothers you just to see this in the United States. It shouldn't be happening. Here's the dental. We will have about 75 dental chairs in operation. You can't see them all back through there. We'll have mobile dental labs. We're doing dental surgeries. We'll be off site at a hospital doing pediatric dental surgeries for these patients and so forth. As well, it's just really, really incredible. That's the number one thing that the people come for is the dental care. It's just so in need. It's followed by the eyes, the second need that the people have. Here's some more just beautiful pictures of the dental that we do. But it's a wonderful event. And I said one of the saddest stories that we had heard out of Ram, there was a 7-year-old boy who was in a dental chair. One of our medicals had went over to get like an order signed, and he overheard the conversation with the dentist. The little boy was in a dental chair, and he was obviously, he was scared, and he told the dentist, he looked up at the dentist, and he told the dentist, he said, whatever you do, he said, don't stop. He said, don't stop if I start to cry. He said, because I'm hurting so bad. And those are the kind of stories that you never get used to, you know, hearing things like that, because, you know, that little boy, he got into the clinic, but there's others out there that are trying to sit and learn in school and stuff like that, and such horrific dental pain, and it just, you know, you never get used to this, you know, in some ways. But we were just so blessed to, you know, be able to come and share our mission with you. And the next part is we're going to show the 60 Minutes piece that focuses on the health wagon. And so again, just thank you. We're going to have a booth set up in the back, answer any questions, and thank you for having us.